Oh, there is Mr. Erod.
Okay, we'll start.
Yeah.
Okay. So,
That's why recording, no?
not sure about that.
Okay.
Okay.
It's saying recording on top, Prasna.
Okay, fine.
If you want, you can record.
Okay, good evening, everyone, and thank you for joining today. So today, over the next half an hour, 40 minutes, I will be speaking about COVID-19. All of us are aware we are in the midst of a pandemic. Please feel free to ask any questions. All of us are here. Kat, myself, I don't know if Ishwar's joined, Lalit, Anand. Ishwar's joined, huh? Not yet. Okay. So we'll be glad to answer. So the purpose of this Zoom session is just to create an awareness of what exactly the virus is, how we can take precautions in order to prevent getting infected, and what actually happens in the event that we are infected, and what does the future hold with the current evidence that we have. So the virus, as we know, is very, very small. It's only 0.1 to 0.125 microns. So what typically happens is that when we stand and when we are with each other, it is not the virus that actually spreads, because the size of the virus is so small that it will still go through any masks or any other barrier that we have. The viruses to survive requires a droplet. So the droplet is something that we exhale out, our expiratory air, or when we speak, when we laugh, when we cough. So these are the droplets that actually travel. And the virus is embedded in the droplets. Now the droplet as such is of a larger size, and therefore masks tend to prevent it. And that is the principle on why everybody should wear masks, especially when we are outside the house, in place of work and everywhere else. And that is also the principle in why social distancing, some people say 2 meters, some people say 1 meter, but at least 1 meter. The reason is when we speak, when we cough, when we laugh, and when we sneeze, the distance to which the droplet travels is very, very different. And the droplets generally travel the highest distance when somebody sneezes. And that is the reason when you have a group of people enclosed in one room, all speaking to each other, or for example, say singing, like in a choir practice, or say in the gymnasium where people are working out, where you tend to breathe more, then this droplet transmission is much higher, especially if it is without masks. The other principle in which this actually happens is the time duration in which the contamination is possible. So low risk is considered as less than 15 minutes, and high risk is considered as greater than 15 minutes, with the premise if we use masks and social distancing. When masks and social distancing are not used, then everything becomes a high risk. So that is the concept of droplet transmission and the size of the virus. The second way in which the virus spreads is something called as fomite transmission. Fomite is it simply gets onto our hands, and then we go and touch maybe the doorknob or the toilet flush or the car door handle or the lift handle, etc., and then it can spread. And surprisingly, all of us, without our knowledge, end to touch our face 5 to 10 times every 5-10 minutes. And then it is very easy for the virus to enter through either our nose, our mouth, or our eyes. So that is the entire principle in how to try and prevent this transmission. So how do you avoid droplet infection is by using masks. I'll come to masks in more detail, and social distancing. And the second thing is wipe down all probable fomite transmissions, especially in areas of work. Why is this thing not moving? So the size of the respiratory droplets are 5 to 10 microns. Therefore, these size are prevented by transmitting through the mask. So that's the principle for that. We spoke about it. So just remember that protection is not only by PPE. PPE is personal protective equipment. It is defined differently in different areas of usage. For example, in a healthcare setting, it may be different. The specifications in manufacturing units, it may be different, or in general public, it may be different. One thing that we need to understand is prevention of transmission is a combination of interventions. We need to do many small things correctly to prevent the larger picture of getting contaminated. We need to do this both in places of work and whenever we step out. For example, going to the grocery store or wherever it is. The intention should be to avoid exposure. The more number of people we meet, the more number of times we go outside, the chances of exposure increase. So the barrier is again two-step. One is all the precautions that we take, and second is all the precautions that the people around us take. So it is critical, especially people who are going to office, people who are going to places of work where we cannot avoid it and we cannot work from home. It is very critical to ensure that all the team members in the place of your work also take all these precautions. Because, to break the risk of transmission, we are as strong as our weakest chain link in the in this entire pandemic. So that is important. Generally, when they test for masks, the filters that are used in masks, they test these masks for about 80 to 90 liters, whereas normal breathing is only around 10 to 30 liters. So overall, we are okay because most of the masks and everything are checked to approximately 3 times their capacity. So do we all need surgical masks? Not required. We can use any mask. We can use cloth masks. Cloth masks are quite equally efficacious in the general public, in the community setting. What is more important if we use these cloth masks are that these cloth masks require to be washed every day. The other step is when we wear a mask, we should not be touching the outer surface of the mask. Now, supposing we wear a mask and then we are meeting a whole lot of people, people are speaking to each other, people are coughing, people are talking loudly, people are laughing. All those droplets are sitting in the outer surface of this mask. So what typically happens if we handle the mask on the outer surface, then we are contaminating our hands. And then if we do not practice hand hygiene, the next time the mask is off, then we are contaminating our eyes, our nose, our mouth, and so many other things. So when you put a mask, it can be a cloth mask, it can be any mask, ensure that you're using the side threads that you have to actually handle it. Don't handle the front of the mask. And when you take it out, maybe drop it into a washing machine. It doesn't matter, because that outer surface of the mask is something that's very, very high risk for contamination. And you would see so many people actually using this to adjust the mask. Then the entire barrier effect goes. And then many people, out of respect, when they come to your room or when they meet you, they actually take down the mask. So you'll need to tell them, no, don't take it down, put it up again. So that's important. So that's the efficiency index which is there. In the community setting, it doesn't matter. You can use any mask. Any mask is as good. Now, what about this N95 respirator? This is a regulated medical device, generally not mandated for general public. It is reserved for healthcare workers. The reason it is called N95 is because it blocks 95% of particles 0.3 microns or greater. And you also have an N99 mask which blocks 99.5% of these virus particles or other things of this size. Now, even these masks, it should be used in such a way, some of them are disposable, some of them can be re-sterilized, but mostly, again, you shouldn't touch the outer surface. Utilizing these masks, N95 or N99, for a longer time becomes very difficult because people who are not used to it tend to have difficulties in breathing. The one with the exhalation valves is a strict no-no. These are masks which are actually N95 or N99, and they have these exhalation masks, valves. So anybody who are in the office or in your shops or wherever, the people who are screening them at the entrance, better to keep a box of surgical masks, and anybody walks around with these exhalation valves, they're not good, because these are masks that are supposed to be used in construction settings, or say in mines or in metro, wherever, when they are doing the construction work, where there is a lot of dust. So these are supposed to be used by them, where you inhale the filtered air through the white surface of the mask, and then there is a one-way valve through which you exhale. And when you exhale it, what happens is so much of the air comes out through that red valve, and it comes out at a very high speed and pressure, and therefore it can go out to a long distance. So any mask with valves are not to be used. They're being sold, including with cloth mask with valves. Typically, this is to allow and permit exhaled air. Surgical masks are good masks to use, especially if you know that you're going into crowded settings. They've become, I mean, they were very cheap earlier, around just some 60 paise, 1 rupee. Due to the pandemic, the rate has gone up to around 4 rupees. But you need to buy surgical masks that are only certified. There are a whole lot of, be it the N95 masks or the surgical masks, that are currently being sold. 70% of the masks and the PPE that are being sold are not certified. So you need to buy these masks that are certified by, anyway, these PPEs right now come under the textile ministry. It doesn't even come under the health ministry. So there is something called as a NIOSH certification. If anybody requires which are the companies where the certified masks are available, just ping me separately. I will send that. The reason is, for people who have employees and for people whom we need that these masks be supplied in their workplace, it is better to get these certified masks. So surgical masks has 3 layers. How do you identify the inner and the outer layer? Generally, the lighter color of that surgical mask will be inside, and then the brighter color will be outside. It can be green, it can be white, it can be blue. The whiter color has an absorbent layer which is supposed to absorb our moisture. The time when you need to change it is greater than 8 hours, or if it gets visibly soiled. Again, like with the other masks, don't touch the outer surface, whether it's a cloth mask or whether it's a surgical mask. Don't touch the outer surface, because the outer surface is where droplets are there. So you can use the masks for approximately 8 hours, and after that it is preferable to dispose them. If you're using cloth masks, ensure that these cloth masks are washed every day after use. And a lot of us have household help coming in. So you give them either a surgical mask every day, or if they're using the cloth mask, make sure that they wash it every day. The other problem that we are having with the pandemic worldwide is that the disposal of PPEs is becoming a huge issue. Whenever we dispose it, it is preferable, bleach is available, dilute it to 5%, put it in a bucket, soak these masks at least for 1 hour, and then throw it. That is our responsibility towards the society, so that somebody else doesn't get infected. Or if it is possible, you can incinerate it. Or there are, in cities, there are organizations that pick up the used PPE. So this is another thing. You should not be bringing the mask down to the neck area, because whatever you breathed out, when you bring it down, you're contaminating your neck area and then bringing it back. So if you're not using the mask, like for example, if you're in the office and you're alone and there is nobody for the next 1 hour or 2 hours, you don't have a meeting, so you don't need to wear the mask if you're alone in the room. 5-6 minutes after the last person has left, the droplets will settle down. You can remove the mask, but remove it using the side ties and place it on the side of your table. The outer surface of the mask is a contaminated area. So make sure you don't touch that. And then again, if somebody else is coming in, you can again wear it. That is much better than bringing it down to the neck. Second, coming to the second barrier for us, I mean, we are all aware, is the hand washing. How you do hand washing is immaterial. You can use hand sanitizer, you can use soap and water, you can use anything. But the principle of hand washing is that you need to do it before and after every contact. And definitely you don't shake hands with anybody. But if somebody comes, they're giving you a bunch of papers in your office, or you're picking up something in the grocery store or wherever, so you use either a hand sanitizer or you use your soap and water. So what it is shown throughout the world, countries which are using masks, countries which are using good hand wash techniques, typically countries like South Korea, Japan, Singapore, they've been able to a large extent, control the pandemic versus countries like the United States, or for example, in India, where people have not yet taken to a widespread use of masks and hand wash. The other thing that you can do for a hand wash is, if there are a lot of people, see, if it is only a bunch of 2-3 people at home, it doesn't matter. But if you're in your workplace, or if there are more people visiting you, then either you do it before and after every contact, or you go by the clock. Minimum you wash your hands every 2 hours, and you wash it with soap and water, more than enough. Sanitizer is something out of convenience, but you need to learn to use the sanitizer properly so that it gets to all the areas of the hands, and you have to air dry it. The sterilization occurs by the period that it takes to air dry. That is more important. If you use sanitizer, and then I've seen people, after they use sanitizer, they take the tissue and wipe it, you've lost it. And be careful about the sanitizer keeping in the cars, where especially if it gets hot. Sanitizers are flammable material, and sanitizer, after use of sanitizer, if you're going near the gas stove, or if you're going near a fire in the puja room or in the kitchen, anyway, you need to be careful, because it is alcohol based and it can catch fire. So sanitizers are okay in the healthcare setting. Sanitizers are okay when you go out, but preferably in office or at home, maybe better to use soap and water. So that's your second barrier. So I spoke about masks, I spoke about hand hygiene. And then the most important and the most difficult thing to do is social distancing. Now, we all do understand social distancing, but it is practically, currently with the lockdown being open, practically it is extremely difficult, both at home, because we have family members visiting, and at work, because we have so many work colleagues going around, and in the other places where we go, to the store or to the petrol pump or wherever. But one thing is clear, and it has been proven across the world, the more number of people you put in a room, the more number of people not wearing masks, the more number of people who are close to each other, the chances of spreading are higher, because currently we are in community transmission. So there are a lot of asymptomatic people amongst us who will spread the virus. And what happens is, then we bring back the virus to home, where there are vulnerable people. By definition of vulnerable, it is less than 10 years or greater than 60, or people even between the age of 10 and 60 who have comorbidities like obesity, diabetes, hypertension, kidney related issues, or heart related issues. So these are all people who are more susceptible to get infected. So anywhere where you can avoid travel, avoid travel. Do not congregate in places either for religious settings or in social gatherings at home or at office. Try and do all your meetings virtually, like what we are doing today. Even in children, children, it is the most difficult to keep them away for social distancing. There is only so much that you can do with children. But if children require to get, if they are actually playing, it is better that they play in the outdoors, where the chances of these droplets roaming around is drastically reduced. So I have made some snippets where going with the risk stratification of the different activities that we do and how risky it is. So going to the doctor, believe me, is still considered to be low risk, with the understanding that most healthcare settings take reasonable precautions. Going to a restaurant, if it is outdoors, it's low. If it is indoors, it's high. Going to a wedding is obviously high. Going to a pool is high. Haircut, low, medium. Beach. Exercising at the gym. Exercising at the gym is typically very high because you have a lot more people who are breathing very quickly. Very significantly. And then the droplets tend to travel more, and also you're sweating. And then there is an air conditioning that's on. And then you have people coming from different backgrounds congregating together. And flying on a plane, no matter who tells what, believe me, the risks continue to be there. So flying on a plane should be done only if it is absolutely unavoidable. People coming back because they have been held up somewhere else or due to some other emergencies. Governments and airline companies are forced to open the airline industry, typically because of economic compulsions. The risk continues because you're trying to put too many people in a closed space for a protracted period of time. Yes, there are HEPA filters on the aircraft, and the airports also take a significant amount of precautions. But if you can avoid to fly, nothing like it. But if you need to fly, then there are a list of precautions that you need to take. And going on with social distancing, like I was saying, avoid concerts, public places, athletics events, crowded retail stores, public transport, which like metro, which the government itself has banned, and be cautious at grocery stores, restaurants. What is safe to do is that you can walk, you can run, you can jog. Running and jogging, it becomes very difficult to be with the mask. But as long as you're doing it outdoors, as long as you're maintaining social distancing, it is very important to keep up the physical activity. So walking, running, jogging is safe. Cleaning the house, going for a drive with the family, as long as you're not getting yourself exposed to, is also safe, because there is only so much that all of us can take being cooped up in one place. And I will share this PowerPoint on the group also. So this has put it as a scale between 1 to 10, where the lowest risk is going to say a gas station, and the highest risk is attending a place of worship, or going to a bar, or going to a movie theater, or eating at a buffet. So that you have some sort of a risk stratification as to what you can do and what you can't do. Now, these are areas that we need to go, but when you need to go, you maintain all these things. If that particular grocery store that you're going to is not maintaining social distancing, if they're not screening in the when they allow people in, those are places probably you shouldn't go. So either you order online or go at a time when the crowd is very less. So whatever works for you. One of the other reasons, I did circulate this also, one of the other reasons that COVID-19 is spreading very fast is because we think they are my colleagues, I know them very well, they are working with me, so it's all right, I can speak to them without a mask. Or they're my close friends, so probably they don't have COVID-19, or they're my close family and relatives, so it's all right. But the truth of the matter is that any one of us can be a carrier. So that is something that we need to understand, that 60% of people who actually get infected are asymptomatic carriers. So I use this 60, 30, 5, 5. So 60 is asymptomatic carriers, 30 is people who have mild symptoms, 5 people are people who have moderate symptoms, and 5 people are people who have severe symptoms requiring ICU admission. And to date, the worldwide fatality rate is 2.5%. I will come to that also. So once you have that understanding, the most positive news in COVID-19 infection is that 98.5% of us are going to get better. That is the biggest positive point. The issue is that we need to, if at all get infected, we need to bide our time and try and postpone getting infected to the extent possible. There are a lot of myths and facts about the COVID-19 disease as such. One thing that revolves is around weather. Whether cold weather will kill it, whether hot weather will kill it. Generally, it's all more of a myth because our body temperature is maintained between 36.5 to 37. So irrespective of the weather outside, we all can get infected. But what is the difference between tropical countries, poorer countries, developing countries versus the developed world is that the developed world uses a lot of air conditioning in the public places, which itself is a risk because once you have a lot of people within an air conditioned area, the risk goes up significantly. Versus in the tropical countries or countries like India, where air conditioning, of course, now is more popular in the general setting. But if you look at the vast rural areas in India, most of the common places where people congregate are generally non-air conditioned. And temperature beyond 37, 38 degrees out in the sun will definitely kill the virus. Some of the other questions that every one of us have is how different is COVID-19 from the common cold flu? So I've put in what are the different symptoms, but typically the first three, which is fever, dry cough, and shortness of breath, are generally symptoms of COVID-19. There are people who get diarrhea, loss of sense of smell and taste, sore throat, and aches and pains. The biggest difficulty is that COVID-19 typically mimics common cold and flu. So that's the difficulty. So if you go on, what you will find is that COVID-19 symptoms are generally gradual, whereas the flu symptoms are rapid. And the severity ranges, I told you all those percentages. The point with COVID-19 is it lasts close to around 2 weeks, whereas most flu settles down in 3 to 5 days. Any influenza-like illness that is not settling down beyond 3 to 5 days, you need to suspect whether it's COVID. Today, the WHO guideline and the ICMR guideline are that anybody having an influenza-like symptom, which is all these symptoms which I spoke about, fever, dry cough, shortness of breath, aches and pains, they require to get tested. One of the other purposes that I wanted to have this session is that there is a lot of hesitancy in people trying to get tested early or people trying to seek medical help. That should not be so. There should not be any stigma associated with the COVID-19 disease. Any one of us at any level can get infected. You're aware that Amitabh Bachchan, Amit Shah, Yediyurappa, whatever. I mean, all these people would probably have been taking so many precautions, but they can still get infected. The message should be that anybody having influenza-like symptoms, please do not hesitate. Get tested. That is very important. And do not self-treat, do not self-medicate. You will need to seek medical help. And also look and make sure that all your primary contacts, even after you get tested, 4 to 5 days later, that they also get tested. If you develop influenza-like symptoms, it is important to quarantine yourself. Very important, because see, some of us have this fever, and then what you do is you go to work. And it is very important to tell everybody in the workplace that if somebody is not well, you have to tell them, please don't come to work. If you are having flu-like symptoms, get tested. All our support is there, but get tested. That particular person, if he has flu-like symptoms, cough, cold, fever, and if he's coming to work, then he's putting everybody at risk, especially if work is happening in an air-conditioned environment. So it is important to give the message that now testing is available. The government has said you don't require a doctor's prescription to test. You can go to any private hospital or private lab and get tested. It is still difficult to get tested in a free center in a government setup. The test rates also have been brought down to close to around 3,000 rupees. There are different types of tests. I'll come to that also. But the message is, if anybody is unwell in the family or in place of work, get tested. If it comes negative, it's fantastic. If it comes positive, we should be happy that we're trying to pick this up early, and we should get all the other contacts also tested so that we are protecting the vulnerable population. Vulnerable population is children and adults greater than 60-65. For most of us who are young, in that in-between age group, we may come out of it reasonably all right. The overall fatality rate is 2%, but the fatality rate in people greater than 65 is 19%. So that's a huge difference. That means anybody plus of 65 getting infected, there is a 1 in 5 chance that he or she is not going to make it. So we all have responsibility towards the elders at home. So make sure that at your workplace and at home, anybody with flu-like symptoms, they actually get tested. And I was telling you about the incubation period and the common symptoms. So it's all listed here. So how does seasonal flu and COVID-19 compare? There is something called as RO number. This is something that is important to note, that in flu, each one person who is positive infects 1.3 people. Whereas in COVID-19, it is double that. Every person who is positive infects another 2.5 people. Now let's take an example at home itself. If I am positive, I have a chance of infecting 2.5 people. If 2 people are positive at home, they have a chance of infecting 5 people, and then it goes on and on. So that is why I am saying that it is important with anybody with ILI. ILI means influenza-like symptoms, to get tested early. And while you're waiting for the report, better to quarantine yourself in one room. I have some quarantine guidelines which I will share on WhatsApp. They're very, very simple things. And today, most cities in the country permit home quarantine. So we don't even need to get admitted. If we become positive, we can quarantine ourselves at home. So rest of that, whatever is there, is quite self-explanatory. So what is the difference between home quarantine and home isolation? It is important to understand the difference. Home quarantine is somebody who is quarantining himself or herself at home, preferably in one room with an attached bathroom. This is when you are waiting for the report. Supposing you have influenza-like symptom, you've given the report and you're waiting for the result. That is called as quarantine. Or if you're moving between one state to another as per the government guidelines, or if you're moving from one country to another, that is called as quarantine. Quarantine means that you're supposedly waiting to either develop symptoms or do the test or complete the 14 days. That is how it is. Isolation is when you test positive. When you test positive, you can continue to be at home as per the ICMR, that is the Indian Council of Medical Research guidelines, and the Ministry of Health guidelines. You can continue to remain at home, but you will need to take certain guidelines. I mean, you'll need to do certain things, and you need to monitor yourself. So those also I will list it out and send. For example, once in 4-5 hours, you need to monitor your saturation. There is a small device called as a pulse oximeter, which is available, which you can actually purchase it and keep it. The reason being, this COVID-19 illness manifests in a way what is called as happy hypoxia. Hypoxia means our oxygen level goes down. Normally, all of us have an oxygen level greater than 95 to 96% when you test it on the pulse oximeter. But if you develop some symptoms, and there are a lot of people who don't go to the hospital and they come to the hospital with moderate to severe symptoms, and when you check their oxygen level, many of them have 55, 65, 75. Now, for what reason this happens is still yet to be understood. But generally, if your oxygen saturation goes below 88%, in the normal setting, all of us develop symptoms. The symptoms could be shortness of breath, giddiness, or sweating, etc., because our body is yearning for that oxygen. But with COVID-19 illness, even if the saturation drops to 55, 65, there are people who are asymptomatic. They can talk on the phone, they can walk, they may have some mild fever or something like that. So people who are isolating should actually get their oxygen checked once in 4 hours. So that's the difference between home quarantine and home isolation. Now, supposing somebody tests positive, one option is to stay at home. What is generally advised is that as long as you have a separate room, separate bathroom, you can go through the 14 days at home, but you shouldn't do it by yourself. You should do it under medical guidance. Larger cities like Bangalore, for example, have these hospitals that will give you a package for 14 days where they do video calls every day. The doctor does a video call alternate day. The nurse does a video call twice. The dietitian does a video call once. And they give you a chart. They send you a kit with a thermometer, with a pulse oximeter, hand sanitizer, masks, and they give you certain guidelines. The important thing is that you can do that at home also, no problem. For people who cannot stay at home, for whatever reason, if you have a lot of vulnerable population, or if some of our staff do not have facility where they have one room where they can isolate themselves, then there is something called as COVID care centers. So what these COVID care centers do is, these need not be hospitals. They could be kalyana mandapams or churches or temples or hotels or any area where they congregate them. So what they do is they check the pulse of, they check the oxygen level twice a day. They check the temperature twice a day. They give them food. They keep them involved in certain activities. They keep them there for around 10 days. Mild symptoms like fever and things like that, they give them tablets. And once they're better, on the 10th day or 12th day, they send them. Because what actually happens is, even when we get infected, the first 5 days, there is a test called as RT-PCR test, which actually picks up the RNA and DNA material of the virus, which is supposed to be the most sensitive one. But the first 5 days, it will be negative. It becomes positive only after day 5 of exposure to day 14. So the tricky point is, the first 5 days, people can be asymptomatic. People, even if they're infected, their test can be negative. And they can still be going around actually transmitting the infection to others. So that's a community health problem. So what they do, and you can continue to infect people up to day 12 or day 14. After day 14, what typically happens is that you will not be able to infect anybody else. So what most of the hospitals do is, and the government does this, so if you have tested positive, it means you're already 5 days old, plus another 10. So they keep you in the COVID care centers for around 10 days. So 10 plus 5 is 15, and then they send you home. You don't need to test again if you are asymptomatic. So that is the principle of COVID care centers. And next is a COVID-19 designated hospital. What I would suggest is, I mean, all of us are from different towns and different cities. You will need to map. You will need to map which are the COVID-19 hospitals around your place of residence. That is very important. Please do not wait whenever this happens. Map out and keep 5 to 6 hospitals around your residence. Talk to the doctors. Talk to somebody who will be able to get us or a close family member a bed when it is required. Because believe me, beds are in extraordinary shortage. Yesterday, my mother's close friend in Ambur. She developed all the symptoms of COVID. She's 74. She came to our Ambur hospital. The chest X-ray showed these features. I tried in Vellore. I tried in Salem. I tried in Chennai. I just couldn't get an ICU bed to give that level of care. And despite being interstate, then I had to get her to Bangalore and admit her here. In Vellore, for example, 1900 beds are full. 1900 beds. It is the largest number of beds that a private hospital has given to the government. 249 beds are full. So we are actually somewhere, in the upward phase of the curve. India will take another 2 to 3 months, and the similar pattern will not be seen across the country. So certain areas, the curve will go down. Earlier, and certain areas it will take more time. So it is important to map wherever you are. Map for a COVID-19. Just remember, only 5 to 10% of us would require an admission in a COVID-19 hospital. 90% of us, we can take care of ourselves at home. I'm talking about our age group, but it might not be with other family members. So map it and we'll need to keep and be in touch with anybody who will be able to probably get you a bed. That is important. Next is about the health insurance. I did send it out on the group also. There is no better time than now to get health insured. Our country has one of the least health insurance rates amongst the developing world. Paltry 7% of the population has health insurance, and another 16% has ESI. It's still extremely low compared to the size of our population. So all of us should have the regular health insurance apart from your company health insurance. And these are policies that give you health insurance only for COVID-19. They're very cheap. The COVID-19 Raksha policy gives out a lump sum payment. If you take this policy up to a maximum of 2.5 lakhs, if anybody tests positive, if you give the insurance company the report that you're tested positive from an ICMR recognized lab, they will do a bank transfer of the sum assured directly into your bank account. The COVID-19 Kavach policy is they actually pay the hospital charges up to 5 lakhs. For people who are running firms and having employees, this is something that is relatively cheap. Today, group policies are also available, which you should take. The advantage of group policy is as long as they are with the firm, this covers. So people joining and leaving every month, it gets adjusted. Policy is available up till 65 years of age. And it may be a wise thing to take for anybody who come across us, like our household help or anybody else also. Apart from this, make sure that you have a general health insurance policy. So what is herd immunity? Now, there are countries that tried herd immunity, like for example, UK in the beginning. And then currently even Sweden is trying the concept of herd immunity. Herd immunity is when 45 to 50% of the population gets infected with the virus. Then what happens is that the virus does not have any more space to spread anywhere else. And then it sort of plateaus. But herd immunity is a very, very expensive proposition for India because our population is close to 130 crores. That means you need to have 60 to 65 crore population that is immune, and they will have a fatality rate of 2 to 3%. That means we will lose out 1.5 crore people. So herd immunity is not an option at all for India. So the next best option is the vaccine. Now, why I touched upon herd immunity, for a population to develop herd immunity, it will take 1.5 years. All pandemics throughout have proven that. If you look at it, over the last 500 years, every approximately 90 to 100 years, there has been a pandemic. The last pandemic was the Spanish flu in the year 1919 after the World War I. And the Spanish flu killed more people than the World War I itself. I mean, the countries came out of the World War I, and only thing they lost millions of people to the Spanish flu. But 100 years from then till now, even 5-6 months into the pandemic, the fatality rate has been quite low. The reason the fatality rate is so low is that hygiene standards are far better as compared to 100 years back. People understand the need for masks. People understand the need for hand hygiene. People understand the need for social distancing. But how did those pandemics stop by itself? Those pandemics stopped by the development of herd immunity. And there was no vaccine then. Because herd immunity developed, the pandemic died a natural death. So much so that 5 years, 10 years down the line, nobody even spoke about, how many of us even knew that millions of people died with the Spanish flu? Nobody even spoke about it. And people, I mean, in our history books, it's all there about World War I, World War II. But the Spanish flu pandemic killed so many people, including wiping out almost 8% of India's population in 1919, which is a huge number. So coming to what alternative we have is the vaccine. Why I am touching upon these two topics is we are already around 4.5-5 months into the pandemic. Hopefully the vaccine will come out sometime in December or January. But just because we have a vaccine, it doesn't mean that the problems are sorted out. We should understand that the world's population is 7.5 billion, and at least 4.5 to 5 billion need to be vaccinated to again touch that herd immunity level. It is a huge logistical nightmare to liaison, to manufacture, distribute, inoculate this many people over a period of time. So the minimum period that everybody is going to get vaccinated, it will take at least 2 to 3 years. It's not going to happen that the vaccine comes and the problems are going to get sorted. The second thing about a vaccine, current vaccine is an injectable vaccine. That means for somebody to get injected, it requires a healthcare trained professional, nurse, or somebody else who's trained, or a doctor to give it. It is extremely difficult. If a vaccine, something like a polio drops come, where the general training, and then you're able to do it. We are all aware of the polio eradication drive vaccines that's happening across the world, supported by Rotary. It is so simple because it is just a oral drops. Anybody can do that. You don't require to be trained. And most of these vaccines require cold chain to be maintained. So by the time the vaccine, and there are companies that are developing vaccines, which is a sort of a nasal spray, etc., etc. The other billion-dollar question is, once the vaccine is developed, who gets the vaccine? That also is an answer that the governments don't want to speak about. Is it the frontline workers? Is it the healthcare workers, police, defense forces, vulnerable population less than 10 or greater than 60? Or is it going to be the people who have comorbidities like heart disease, kidney-related problems? How are we going to vaccinate a country as vast as India with the limited resources that we have? Nobody knows all those answers yet. So my gut feeling is that either herd immunity or 30% vaccination, or a combination of vaccination and herd immunity. By the time all this develops and pans out, I think it will be September 2021. So what I'm trying to give the message is that all of us should not have fatigue with this pandemic. We are somewhere in the initial phases, actually. It's going to take at least a year or little more. If vaccines come in very quickly, and if there are different ways of deploying the vaccines, or if herd immunity spreads very rapidly without all of us knowing it, probably my predictions may be wrong, but it can be wrong by maybe 4-5 months or 5 months or 6 months. It cannot be wrong that, by November, December of this year, everything is going to be all right. It could be all right by March, by June, or by September. So mentally, all of us need to prepare ourselves physically, mentally, emotionally, financially, both at home and at workplace. So we need to prepare ourselves for the medium to long haul. So that's the second message that I want to give. It is very critical because, we all look towards hope that things will get better. It will hopefully get better, but most pandemics historically take time. Now we are far better currently because our understanding of the healthcare and health related processes are much better. The second thing why I am urging everybody to use extraordinary precautions is, see, the understanding of this disease in February and March for the doctors who are treating the patients as compared to what is now is very, very different. In February, March, April, all of us thought that every patient who has COVID would most probably require a ventilator, and then there is a significant shortage. All of us thought that it is a disease primarily of only the respiratory system. Now we understand that it is a disease of the vascular system, of the heart, of the kidneys, and so much new treatment has come. A whole lot of people are not going on the ventilator. We do understand that 70 to 80% of them do not require admission. Moderate to severe symptoms develop only in 5 to 10% of them. If we bide our time, if we delay getting infected, probably the treatment will also be much better, because the doctors in all these hospitals which are taking care of the COVID-19 patients have a better understanding of the disease. That is why it is called as a novel new. So it is a new virus. We yet to understand how it reacts and works, and therefore the treatment strategies are also very new. So it is important to try and bide our time. Either if it is after a couple of months, then the understanding in the hospitals are better, or hopefully the vaccine will come. There are close to 140 companies worldwide that are doing these vaccines. Generally, vaccines take 4 to 7 years to develop. People are trying to compress it and do it in 6 to 10 months. It will come out. Vaccines will come out. The general efficiency of vaccines should be 90 to 95% to actually get rolled out. But typically, even if you have a 50 to 60% success rate, the governments are going to allow it to be rolled out. So we need to bide our time for the vaccine or the herd immunity to develop. Now, this is more important. See, there is so much of negative news all around us. So I would suggest that we need to look at this all extremely positively. We need to ensure to keep ourselves mentally very strong, and all of us need to support each other, be it in the friend circle, in the family circle, in the relative circle, or at places of work. These are extraordinary times, and these will test our mettle. And to the largest extent possible, we need to take care of everybody around us. If we can take care of people at work, we need to do it. If we need to take care of people at home, friends, family, we need to do it. I think 2 generations have actually skipped being affected by a pandemic to this scale. And today we know that the world is extraordinarily connected. So by the time normalcy comes, it's going to be at least a year. One of the reasons I wanted to do this session is, if all of us are prepared mentally that it's going to take a year, then so much changes for all our plans. So best is not to read the news, because it completely overloads. If you're reading the news, read positive things, or just read the news maybe 10-15 minutes a day just to see what's happening. It is extremely important to take care of ourselves mentally. And believe me, everything else can wait. New business ideas can wait. All of us may not be making that much of money. It really doesn't matter. These are times when we need to sustain, survive. We need to take our family and our co-workers and our organizations, we need to stabilize them. Once the pandemic is over, everything will bounce back. The nascent demand which is there in our country is going to continue to be there. But the point is, we need to survive. First, we need to be alive. And second, our organizations also need to be alive. So these are times when we need to ensure that we last out the pandemic. There will be companies that shut down. There will be organizations that close down for various reasons. We can't help it. We can't say that 100% of everything what we knew will need to be there at the end of the pandemic. It's not going to happen. Better that we prepare ourselves for the medium to long term. So this is a recommendation by the WHO. It's normal to feel sad, stressed, or overwhelmed. Doesn't matter. Talk to somebody, pick up the phone, speak to anybody. And I think in the group that we are in, I think any one of us can speak to anybody on anything. It's extremely important. It is also important to maintain a healthy lifestyle, proper diet, physical activity. And at places of work, if you find that you're not able to cope up, it's important to speak out. And similarly, in situations where we are able to contribute, the same thing should be done for all our co-workers and staff also. So you can do different things to cope with the stress. We should understand that it is stressful for all of us. It's stressful for family. It's extremely stressful for children, because children are, especially if they're younger than 12, 13, they're not used to being cooped up all the time. And we need to see how we occupy them differently. And I really wouldn't suggest sending anybody to school or boarding school for this entire year till a vaccine comes out, because children can be silent carriers. So we can talk to loved ones, maintain a healthy lifestyle. Don't use tobacco, drugs, or alcohol to cope. Get the facts right, because facts are very important. And look at doing anything, any hobby, any skill, anything that keeps you occupied is something that you need to do. Or there are few of us who would want to meditate or do yoga. Do that. The funny thing about this COVID-19 virus is that, see, it's not the virus that causes the major problem. The virus causes flu, it causes cold, cough, it causes a pneumonia patch. There are so many bacteria and virus that causes that. But the problem is it is a new virus. So as human beings, we are all evolved over millions of years or over hundreds of years, where genetically we are resistant to a whole lot of microorganisms. When a new virus comes in, the body treats it as enemy number one. So our body goes against this virus and creates a very, very severe inflammatory response that does all the damage, actually. So what happens is the body reacts violently to this foreign body attack. And when those become too much overwhelming, it tries and kills the virus, but in the bargain, it damages a lot of normal cells. Now, why does that happen? It happens because people do not seek early medical help. That was the purpose of me explaining that. So if you are unwell, get tested. Get a pulse oximeter, keep it at home. If the saturation drops below 94%, it's time to get hospitalized. You need to get hospitalized before the inflammatory response kicks in. And today, the understanding of the disease is so much better. Treatment is available before we reach the tipping point. If you reach the tipping point, then it becomes difficult. But just remember that a very, very small minority, only 1.5 to 2% of them reach that tipping point. So there's no need to get scared. There's no need to get panicked. It's better to speak about it openly. We need to remove that stigma of this disease, and we need to be proactive, because any one of us can get infected at any time. It really doesn't matter. If there is a suspicion, get tested, seek medical help, and then if required, get hospitalized early. And that should be the advice for everyone. And amidst all the bad news or the sober things which I have spoken about, there is a lot of good news. There are countries that have overcome it. They probably got to some level of herd immunity. If you look at the Dharavi slums, a surprising 55% of them have developed immunity. So nobody knows. See, I've been speaking about September 2021. If you ask me 100%, am I all right with that? I may be wrong. But I'm trying to prepare everybody for the medium to long term. but we don't know how this disease actually reacts and how it is going to pan out over the next couple of months. And we do know that a whole lot of drugs are also available and vaccines are also coming out. So these are all good news. And the other good news is that as a population of our size, 135 crores, I think India has done a reasonably fantastic job. The lockdown was initiated very early because we knew that our healthcare facilities would get overwhelmed. It gave us around 3-4 months of time from not producing PPEs to becoming the world's largest PPE producer. A lot of factories, be it in Tirupur, Bangalore, everywhere, have become the India's largest PPE producers. From blocking exports to the government opening exports for PPE, the government also can do very little because the pandemic is of that impact, and India is not a very rich country for the government to take care of everything. It did give us some time for the healthcare facilities to put in things, and unfortunately, the lockdown can be kept only for a certain period of time. For a country like India, even that lockdown 1, lockdown 2, lockdown 3 was pretty long because the economic impact is massive. Industries will shut down, companies will shut down, businesses will shut down because we are one big cycle which supports each other. And once revenues get hit, what will happen is it will have a cascading effect. So I think what happened during the lockdown was that to whatever extent we could, we put in the healthcare systems in place, and rightfully so. As soon as the lockdown got opened out, we find that the healthcare systems are completely overwhelmed. But it's okay. Generally, there is an awareness to a large extent of what this disease can do. And overall, as compared to many other countries, our fatality rate has been quite low. So please look at all of this in the positive news, in the good news. Don't only concentrate on the negative news. This also I circulated. This is for people who are staying in community settings. I will send it again. Typically, don't congregate too many people in one room, especially in an air-conditioned environment. If you need to do the meeting, do it with social distancing. Leave the windows open. If you need to have the air conditioning running, leave the doors and windows open. It doesn't matter. And then run the air conditioning. If you can do that virtually, nothing like it. Now, about household helps, we all need to have household helps because a lot of us are working and our spouses are also working, or we require it because we have elderly at home, or whatever reason, we have young children at home. For the household help, what I would suggest is that when they come in, they have to wash their hands. Give them fresh masks. It doesn't matter. When they are at home, they need to use masks. Maintain social distancing to the household help. If they are in the kitchen, make sure the windows are open. And what I would suggest is our family members, along with the household help, shouldn't be in the same room if it's possible. If he or she is a cook, just tell them what to cook. It doesn't matter. We don't need to be there. If they're cleaning the room, we don't need to be there. And if they can stay for a shorter period of time and then leave, nothing like it. But again, simply maintain the same thing. Masks, hand hygiene, social distancing, even with household help, because household help can be carriers. If you are having a live-in help, nothing like it. If you are having a help coming from outside, at some point of time, there is going to be a community spread. And we can only postpone it, but just look into it and then keep these precautions in place. If they're wearing a cloth mask, they need to ensure that they wash it. Train your household help not to touch that mask often, not to fidget with that mask. The outer surface of the mask is contaminated. Ask them if they're wearing a cloth mask, when is it that they have washed it? Or give them a surgical mask when they come inside. These surgical masks or any type of mask, believe me, it just takes 2 to 3 days to get used to it. After that, you'll get used to it. You'll get used to it so much that when it is not there, you will find that something is wrong. So ensure that they actually wear it. And this is also something that I sent. So I would like to end with this slide. So you need to know how to utilize this happiness chemicals, and believe me, they are true. Any of these activities that we do triggers these chemicals in our brain, and it gives us a sense of well-being. These are all small little things that we need to strive to do, because as I said, that the pandemic is unprecedented. Nobody has had experience with this. So nobody can tell us, neither our grandparents nor our parents can actually tell us that they've been through something like this. So probably if we all make it through, we will be probably telling our children, our grandparents, that we've gone through this, and hopefully this pandemics of this scale won't come back. But to the largest extent they've gone, I've said that it will usually come once in 100 years, and that's how it happens. So try and do all of these things. So thank you. So that was it from me, and I think all of us doctors are here. We'd be glad to answer any questions that are there. You can either chat it or you can speak up. You can, I think, unmute. Okay, I have some questions. I think Gundu has asked, is there something called as a second wave in India? So that second wave is actually what is happening because of the lockdown getting released. See, and generally what happens, again, look at the cycle. You are releasing it to everybody, and then each of them take 5-6 days to get symptomatic, and to get infected and get symptomatic. And the biggest problem is only 30-40% of them have symptoms. So 60% of them don't have symptoms. So yes, you will see very soon India will overtake Brazil and the United States. We will become the country with the largest. We will become the country with the largest population of COVID-19 patients. It doesn't matter because see, we are a democratic country. Probably China has more numbers. Probably they're just not letting it out. Second thing is our population is massive. So with that massive population, it is only known that it will have these numbers. Doesn't matter as long as we try and remain in that 95%. Then Rose has asked the same thing. I think second wave coming by November. Different areas in the country are going to have the peaks in different times. So it is going to be there everywhere. Raghu has asked, is the virus airborne? See, this was just one study that said that the virus is airborne. The virus is airborne, but the principle is it needs a droplet to survive. The problem is, how long can a droplet go? So if somebody is singing like how they sing in the opera, it will go even 5 meters versus in the normal conversation. So okay, I'll tell you what we do in the hospital, because we understand that this is what. So what we do is we keep the chairs, even in your office. Generally what happens, the chair is next to the table, right? So move the chairs back. So if you're sitting on one side, move the chairs all the way to the other side so that there is a social distancing that's maintained. If you are having an air-conditioned room, yes, no problem, but run the AC and open the window and the door so that there is cross ventilation also if you have somebody to meet you. If somebody is coming to meet you, make sure that they wear a mask, and make sure when they come inside, because they want to speak to you, they'll take out the mask. Tell them, no, please wear it. And if they come and go, and if you're collecting papers, doing whatever it is, make sure that you use hand sanitizer or wash hands. If you can do anything virtually, please do it. If you have 10 of your staff trying to meet you every day, tell them if all this work can be done over the phone, over WhatsApp, over email, do it. If you still want to go to the office, go, because it's a good change in mind. But make sure that you do all these precautions and sit by yourself. It really doesn't matter. Try and cut down, and that should be the message throughout the organization. Everybody should not try and meet each other, because I showed you the chain, 1 person to 2.5 to 3. So we are more susceptible to actually try and spread this to everybody. So that is very important. Okay, anything else? Gopes, why are you in serious thought? Hi, Hari. Hari, unmute yourself.
Guy, Prasna, you.
All well. I think you joined late. How are things?
Yeah, good, Prasna. Good. So
Doctor,
I just, I'm the one going outside, coming back inside. So I'm worried if I get it or something, what happens to the family? I mean, how do we, you talked about it, home quarantine and the home isolation. And the biggest
Yeah.
challenge, what you're saying is getting beds in the hospital. We have to book something in black.
No. It is true. It is true. So I know of hospitals in Bangalore where people are donating 5 lakh, 10 lakh in booking a bed.
Jesus.
Oh my God.
Hospitals in Hyderabad, I mean, it was in the paper today that they pay 1.5 lakhs. This is to reserve a bed.
Yeah, I don't know.
Now the point is not that. Most of us hopefully will not need a bed. But the point is to try and avoid getting infected. And it's extremely important when we go out in the places of our work to make sure that we don't get infected. And but that's the stark truth. Raghu has sent a question: is plasma donation blood group related? Yes, it is. So what they do, I didn't speak about this. Okay, there are 3 tests. One test is your RT-PCR test, which is the most commonly used now. The RT-PCR test generally picks up the DNA and RNA material, and it is positive usually from day 5 to day 12 or day 14. So if you're testing before day 5, your RT-PCR test may come negative. If you're testing after day 12 or day 14, whether it comes negative or positive is immaterial because it is only picking up remnants of the virus. Okay, so that's one test. That's the most common test that's done. That's done by that nasopharyngeal swab or that oropharyngeal swab, one very uncomfortable test. The second test is your rapid antigen test. Your rapid antigen test simply tells whether you have the infection or not. So that usually happens between day 5 to day 14. But the rapid antigen test is good only, I mean, the test itself, efficiency is only 65%. If your rapid antigen test is positive, that means you are having the infection at the moment, right? So these rapid antigen tests are the tests that are used by certain airlines or by certain companies and all that, because the test report comes in around 30 to 50 minutes. If your rapid antigen test is negative, it still does not mean that you don't have the infection. You still need to do an RT-PCR test. The third test is what is called as an antibody test. Antibody test is when a virus infects us, our body as an immune mechanism develops antibodies. The antibodies are again of 2 types, short-term and long-term. So that antibody test, if it is positive, that means at some time you've been infected over the last 3 to 4 weeks. And the good thing about that antibodies is it lasts for around 2 months. Now, will somebody develop a reinfection after 2 months is not known. But if you compare it to all the other infections, viral infections, generally either the virus itself has to have a different strain and mutate itself. Generally, it is resistant because the resistance against is of 2 types. One is your antibody and T cell. The T cell is something that you cannot measure. So to cut a long story short, RT-PCR is the best test to do. But the problem with that test is if you do it before day 5, it will still come negative. So if somebody continues to have persistent influenza-like symptoms, you may need to repeat the test despite your first test being negative. If you are having influenza-like symptoms, flu-like symptoms, please quarantine yourself. Amongst other family members, especially the vulnerable family members like the elderly and the younger children, and then test yourself. If it comes negative and you're getting better, no problem. If it comes negative and you're continuing to have flu-like symptoms, you need to repeat the test. The earlier we test, the earlier we find out whether we are negative or positive. If we are positive, then we need to check all our primary contacts also. And then if required, only we need to get hospitalized. But the point is, please don't hesitate to do a test. Gundu is asking, will hospitals give priority to COVID patients? If the case is going to increase, don't think there will be enough beds. Can we choose the hospital? All hospitals are giving the priority to COVID patients. Hospitals in Bangalore, including private hospitals, the government has taken over, they say 50%, but maybe around 25 to 35% of the beds. The other problem, what's happening, what we're all seeing is that anybody who is unwell are not going to hospitals early. See, all the other disorders and diseases continue to remain, right? But people are not going to hospitals early because they are scared that they will contract COVID from the hospital. And then what happens, they get very sick. And then when they come in very sick, it creates a lot of problems. But hospital beds is an issue. Better to map out your area and figure out, have some option 1, option 2, and things like that. No evidence. I see Rose has asked a question about clothes and laundry. No evidence actually, because once you put it into a washing machine or hand wash it and dry it, it really doesn't matter. The concept again is not the virus. The virus cannot survive by itself. The virus will survive only with the droplets. So even at home, when we have a lot more people, supposing you have your household help, the household help also needs to wash hands. If you are in the kitchen or if you are moving around them, you also need to wash hands. So the hand washing depends upon the activity that you're doing and the people who are around you. So the more often that you wash hands, the better it is, especially when they are around for that period of time. Pet dog is fine. You can play with it, no problem. If any one of us is pregnant, congratulations, very adventurous. Okay, pregnant, anybody who's pregnant is at high risk. It works both ways. There is no proven transmission which happens in the placenta between the mother and the child. They have done a lot of studies in the newborn babies. They haven't found a maternal direct transmission, but transmission happens later because it's almost impossible to do social distancing between a newborn and a mother. So it's very difficult unless the mother is symptomatic. So somebody who is pregnant, especially in the terminal phases of pregnancy, so what they do is they do a C-section early because they're worried that the mother would get symptomatic. Somebody who's in the first trimester, second trimester, I mean, pregnancy overall brings down immunity. So they're as equal to everybody else. Do we need to have a bath every time you come home? Yes. Now, if you ask me exactly why, I may not have a scientific answer for it, but it is again this droplets. We don't know where these droplets are. We are going out, we're speaking to so many people. There are people who are coughing, sneezing, there are people coming. So we don't know where it is. So it is preferable to take a bath. A lot of these things, if you look amongst the Indian customs, is probably when the hygiene of our country was at a very, very different level earlier. To prevent flu-like illness, so what people used to do is we used to leave our footwear outside the house. We used to wash our hands and feet when we enter the house, and when men used to come back, irrespective of whatever time it is, they actually had to have a bath and come in. So a lot of that is actually come out of these pandemics and these flu-like illnesses. Pandemic is when, across the world they are affected. But within our country, there have been numerous epidemics that have happened. Epidemics is when it is a much smaller area, maybe a district, maybe a town, maybe a state. So I think all those practices of hygiene are good. Vernon has asked, if the droplet dries, does that reduce surface transmission? Yes. Once the droplet dries, say sun dries or dries by itself over a period of time, then the virus will no longer survive. Okay. Anything else?
Krishna, one question. The antibodies test, right? So I heard, is that positive only specifically for the COVID virus, or you get a positive for like any of the, let's say it's an influenza, right? So would you still turn up positive with an antibody?
No, this antibody test which they are doing, they are testing it only for the COVID.
Okay. Okay.
So it is specific to that.
Cool.
Sebi, I'll try and send you that recording, Sebi.
Yeah, can you send it to me as well? I missed the first half of it. I got in a call.
Yeah. I'll put it on the group. Hey, Badru.
Yes, Doc.
What's happening, Badru? Okay. Where is JP?
JP, where's the cake, JP?
Hey, where's JP? JP is gone. Huh?
JP is there, man.
Is there? Unmute and talk, JP.
The one looking like a sadhu.
JP, we can't see you. Hey, hi, Ishwar.
Hi, Parsuram.
Ishwar, can you speak about children, Ishwar?
Yeah, very much. What do people? All the children are grown.
Hey, Illappa, I have a small child.
Hi. Okay, guys. Good thing for pediatric cases. There is a children less than 16 years. We do not have severe infections. In the last 2 months, we had about 65 pediatric cases admitted just because the parents were infected and child reports were positive. Nobody did not have pneumonia, and they are doing well so far. In Chennai, we are not ventilated one cases, so even one case till date. And I am being a part of the newborn care. We have so far 12 mothers delivered who are COVID positive, and all the 12 babies are COVID negative. So with the respect to them also, but what we are seeing in the clinical practice is few children come back with fever. That again, COVID positive, whether they are picked up from the neighboring person or the caretaker. It is not through maternal transmission. So people who are pregnant, they can be happy, not to worry. One thing is different of this. What is this? A special thing about this virus is usually there are some viruses called chickenpox, CMV viruses. They increase in the first trimester. Infection rate is very high in the first trimester. As the trimesters go, as the pregnancy near completion, that increased risk is not there in this coronavirus. And what I want to use, anybody, any doubts? So it's a good news for the children.